going to pick a wound. You won't know what it is. You're going to walk in the room and evaluate the situation. So we see Lindsay has blood here. So we're going to give her some gauze and tell her to apply direct pressure. So she's going to do that while I get my personal protective equipment on, meaning gloves. Okay? So I will apply my gloves. And you're going to treat this all like it's real blood. Okay, and then once I get my gloves on, I'll ask her to remove that so I can assess whether it's a laceration or an abrasion. It's clear to see for hers that it's a laceration. So we're going to tell her to treat this like it's biohazardous. This white bucket for now is our biohazard bag. She'll put that in there. Then she's going to wash her wound with soap and water. Okay, so once she's washed that with soap and water, for a laceration I'm going to apply steri strips, which are in this container, or butterfly bandages. So I'm going to pick how many butterfly bandages based on the size of it. I want to make sure I can cover that up. When you apply a steri strip or a butterfly, you're going to pull the skin back together a little bit so that you close up that wound. Okay? And this is just temporary because we're going to then send her off for stitches after the game. Remember, we're preparing them to go back in the game. So I would never give you a laceration that's too big for this to go. Okay, so we've applied our 2 butterfly bandages, and now she needs to be taped up and ready to go back in the game. So we're going to assess what size bandage would cover this area, but not stick to these steri strips. So the best choice would probably be a Telfa pad for hers. Remember, a Telfa pad is not a Band-Aid, it's just non-sticky, non-adherent pad. Inside of Band-Aids is also a Telfa. Okay, so we'd apply this and have her hold that on there while I get the tape. Ready? So then I apply stretchy tape around the whole area, making sure I don't get it too tight. So I just pull it out and then wrap it around. Okay, and then I'll keep that stretchy tape on with a strip of white tape. And then I would tell her that she needs to go for assessment of whether she needs stitches after the game. But for now, she would be ready to go in the game. And then things to monitor, she needs to change this bandage every day and watch for signs of infection, which are heat, pussiness, redness, fever, and she monitors that every day. Then I'm going to treat my gloves like they're biohazardous because I've been touching blood. So the proper glove removal has to be done. You grab the outside of your glove on the first one, and then you put your fingers inside the glove and turn it inside out on the other. If you make the mistake and you lay your gauze, your bloody gauze down here, that's okay as long as you clean it after. So we have bleach. But if you treat it all biohazardous and put it in the biohazard bag, you don't have to clean that up like that.